training stadium of the National Sports Club of India was one of the first centres to be converted into a jumbo COVID-19 facility anywhere in the country. This centre here in Worli has till now housed about 1,800 COVID-19 patients, some of which were really high risk, like pregnant women, people with a lot of comorbidities, cancer patients, etc. What started as an isolation and quarantine centre quickly moved to taking care of moderate patients who required oxygen support, and now this facility has been converted into a proper COVID hospital with ICU setup. Well, getting an ICU in a stadium was the toughest part, and hence portable ICUs were set up, have been set up in shipping containers. Yes, you heard it right, in shipping containers, with artificial intelligence and a lot of technology being roped in. There are monitoring systems being set up with which doctors from across the country can actually consult the patient inside if the need be. That's taking telemedicine to the next level. Well, the recovery rate here in NSCI has been one of the highest, and that's one of the big achievements of this centre. A lot more technology and innovation has come in, like contactless screening and contactless OPD centres where the exposure of the doctor to the patient is minimized, and a lot more things. Let's take you inside this facility to show you what more is being done here. Here are the country's first and the largest jumbo facility to take care of COVID care patients. This is the war room that has been set up at the NSCI Dome to remotely monitor the ICU patients over here, and to help us understand how this facility has come about and the new ICU monitoring systems that have been set up. With me is Dr. Lakrawala, Dr. Mufi Lakrawala. He's popularly known as Dr. Mufi, who's responsible for setting up and converting this indoor stadium into something like a hospital. And a lot of newer innovative ideas have been brought in, volunteers have come in, and this is the man behind taking care of COVID care patients early on in this pandemic here in Mumbai. Dr. Mufi, first of all, thank you so much for sparing time for CNBC TV 18. Help us understand what you've been doing here. It's been, what, 100 days now at this NSCI facility? You've started it from scratch. How did it come about?
Yeah, we're coming close to 100 days, and we started it from it being a stadium which was meant for music concerts and rock shows and everything, and I was told to convert it into a facility for isolating patients who were COVID positive in the first red zone of India, that was Worli.
Right.
So I'd been given 5 days. I probably didn't have the staff that you're looking around and seeing right now. I had 7 people in my team, out of which one was a surgeon, one was a nutritionist, there were 4 physiotherapists, and there was 1 intern. Okay. And I had 24 student nurses to play with.
Okay.
So that was what I was given. We had a lot of patients at the beginning days. There was a lot of things that were not known, and there was lots of stigmatization. Even doctors were very scared to come out, so I didn't really have too many people to play with. And that's how it all started. It started on a humanitarian basis. For the last 3 months, we've run this facility only on humanitarian efforts. So I'm proud to say that not anybody has taken a salary per se out of this facility so far.
How many people are working here at this point in time in terms of doctors, nurses?
Right now we've got close to 84 nurses. Yeah, because the ICU and various other things of the facility. We've got a rotating team of around close to 40 to 50 doctors, because we've got interns who keep coming and going every 15 days or every week or something. And then we have a few intensivists, like Dr. Shiva's here, who've come again voluntarily, completely. So he's taken time off from where he's working and come to help us because we've set this up. So it's been a completely voluntary effort so far, and we're pretty proud of it, because until we started the ICU, we had treated close to 1,800 COVID positive patients in various stages. More than 300 of them were above 60 years of age. The oldest patient we treated was 94 years of age. And the youngest patient we treated has been 2 days here. We've treated more than 250 cancer patients out over here. So we've treated them all, pregnant ladies, around 25 pregnant ladies. And we did innovative things. So with the help of IITB Council, we used technology to its fullest. So from contactless clinics that you just saw to remote monitoring and of patients from their bed. So you would get it on screens like this. So technology has really helped us go from one stage to the other. We use artificial intelligence for X-rays and various.
I'll come to that in a bit. I just want to understand on the manpower resources that you were talking about. You're saying that every single person who's come in and worked, whether they were the nurses, whether they were the doctors, intensivists, they've all done that on a voluntary basis till now.
Yes, at least for the first 3 months, that was the thing.
Okay. And now with it going to the private
except for the labor class, the sweepers, they were paid, of course. So, but the doctors are all voluntary. And the great thing about that was that nobody had timings, right? Because everyone came in for voluntary services. They wanted to go out and save people. So it was 24/7. So nobody had sleeping hours, nobody had waking hours. If someone deteriorated, there was a team of doctors that would rush in and save that patient. So that's how we managed to win this war.
See, that's the human side of this entire pandemic crisis, where the frontline healthcare workers have stepped up and how to save patients. Now, help us understand, Dr. Lakrawala. We've read that the recovery rate here at NSCI has been one of the highest across facilities in Mumbai, and even as compared to some of the other facilities across India. How have you been able to manage something like that for a large facility, and when you say that this was one of the first hotspots?
So this has been the first jumbo facility in India. And like I said, I used to read a lot about, I'm a surgeon, so I'm not an infectious disease specialist, not an internist. I didn't know much about corona until this started. So whatever was being learned by people across the world, and this is still an ongoing learning process, right? With corona, we don't have answers. We don't have a drug that cures it. We don't have a vaccine, nothing else. So we used two basic things. We used serial X-rays to see who was worsening and put patients on oxygen way before they actually deteriorate. So an old man would get oxygen before his saturations would drop below 94. Just because we saw a worsening of X-rays, then that would be one thing. And the other thing we used very, very extensively was blood thinners. Now, evidence is emerging from postmortem reports and everything that a lot of these patients are dying because of thrombotic events. This is a thrombogenic disease. So we use that randomly. We used that on every patient who was above 50 years of age. Any patient who worsened, we used low molecular weight heparin. And I think maybe somewhere, we didn't do it like a trial. I wish we had done it like a trial, but I didn't want to lose patients, so I couldn't have randomized patients. But I think that is probably what has really helped us. We didn't use any of the fancy drugs that we are talking about or anything of that sort. So simple 200, 300 rupee medication. And then, of course, in the beginning stages, we use HCQS, we use azithromycin, vitamin C, and various other things. A lot of people did use gargles. Every patient inside started using gargles, hot water, and various other things. We don't really know what has helped. But I think low molecular weight heparin or blood thinners, and probably picking up patients who might deteriorate and might put them on oxygen so that they probably don't have the full-blown response that interleukin-6 crisis would bring on. That's what I think.
Tell us, what are we doing here? Just 10 days ago, you've started your ICUs. This is one jumbo facility where you've set up ICUs in shipping containers, is what we are told. Tell us about that. Tell us about how that came about, the requirement for ICUs here. How much was that? How did these ICUs come about, and how are you managing them here?
So I was, like I said, we saved a lot of patients with just mere oxygen. So I was one of the first ones who said we need large amounts of oxygen. Yeah, and that's when the thinking in the hierarchies of the BMC also changed, and they started procuring all these jumbo tanks that you're seeing everywhere. So we built up oxygen banks, and that kind of started the process. The other thing was, in a rock stadium, how do you manage an ICU, right? In an ICU, if you walk into a conventional ICU, you realize, and that's what most of my friends, who are some of the leading intensivists from all across Bombay, thought I was completely crazy when I was thinking of an ICU in a container model. But I wanted to save more people, okay? I said that even if I give them a chance, rather than them dying on the streets, if I give them a chance here, we would always fall short of ICUs and critical acute care beds in our conventional hospitals. We just wouldn't have the numbers.
Right. And we saw that happen. We saw that happen.
And that would happen across the world. It happened in New York, it happened in Spain, it happened in Italy. any infrastructure, healthcare infrastructure is not prepared for a pandemic of this kind of proportions. So I said, how do I set up an ICU here? So that's when this idea of in a container setup came in. Now the other thing is, because this is not like a conventional disease, I had to decrease the viral load. So I had to put in HVAC systems into these containers and try and decrease the viral load. So technically, I think I'm very proud because this will decrease the viral load. There are containers here, and my whole idea has been that what do we do? We put in so much money in this infrastructure. What do we do once it gets over? So these can be completely and permanently utilized, because we still have a lot of people dying out of tuberculosis in India today as well, and they need negative isolation. And these will serve like perfect foils for them.
You know, you are monitoring it from here. How many doctors are there? You have 10 operational ICU beds right now, and another 35 are going to come up more. So how many are managing patients inside those ICU, and how many of your members are managing it from here? And how does it work? How do you connect?
So this is like a kind of war room concept, right? You've got 3 monitors. One has got the entire patient details. It's got also patient investigations. So if I click, I can see all his X-rays, CT scan, whatever blood investigation, I can see them all. This has got all the patient's profiles. So if one patient is not doing well, I can click on that and go in and zoom into just that patient's profile, and I can monitor that patient. This is more a common thing. So we can monitor around 16 patients in one block. When we have 16 patients, all of them will come. Every 16 patient blocks is treated separately. So mainly we need our senior level intensivists here. We also have intensivists who are placed near the ICU, just in case someone deteriorates or goes in. And because of monitoring, so let's say if a patient needs to be intubated, Shrivats will change in, dawn in, and reach there within hardly any time and be able to save that patient. So because of this intensive monitoring, in most ICUs, you get this kind of model, which is a CMS model of monitoring, but you don't get lifetime feeds of the patient. So in this, because we get lifetime feeds, we are getting images from the patient. I can video call that patient and talk to them. Let's say if Shrivats wants an opinion from someone more senior to him, or probably a cardiologist, or probably a nephrologist. So what he can do is he can video call that person, and lifetime 3 or 4 doctors can be on the same patient giving the advice. So it's kind of narrowed down the whole aspect of remotely monitoring and a really acute care patient.
But just as a follow-up question, doctor, what if the doctor sitting outside wants to actually monitor the patient and see certain parameters or physically observe certain aspects? How do they connect on that? Is it only through the audio call and a little bit of a video, or how do you manage that?
This is the video. So let's say with Google lenses, the person sitting inside can wear Google lenses. Let's say the doctor sitting outside wants to see the left side of a patient. He can tell him, please show me the left side. That image can be transmitted here. Okay. The other thing is auscultation. Let's say the stethoscope. If I want to hear his heart sounds or his breath sounds, with a remote device, I can, sitting here, audibly hear his heart and breath sounds without me physically being there. So that's all possible now with technology.
Right. How has been the condition as far as availability of drugs, availability of ventilators, availability of the critical equipments and medications that you require to treat your patients? How has been that so far, and what do you see going forward?
See, there are always challenges, right? I was a private player. I've never realized the shortage of equipment or drugs or something. The first time I was working with the Bombay Municipal Corporation, and there's always going to be challenges. But I must say I've not had that bad an experience. It's been great. They've provided me with the best equipment that there is. I can tell you that some of our container ICUs are better equipped than some of the private hospitals that there are. Okay. Yeah, we've got high flow masks, we've got BiPAP machines, we've got ventilators. We've also devised certain things like hoods. Like Kapil and all, I sat on an idea, I spoke to them, and we sat and we made oxygen hoods, which would plate the patient in oxygen. And
so not only the one that
not
goes
the mask,
on your...
it just goes and fits on. You'll see it when you go inside the operation theatre. There are hoods, the actual hoods. We've devised and we sat on and worked in. So basically, the way the system works is you have a central monitor which monitors the screen. So there's a camera inside which monitors people are feeling the same.
Then you see the war room.
It's not stuck with the patient.
Well, this is a pretty innovative idea. And just now we'll go into the ICU also to see how a proper ICU has been set up in a shipping container, and how this type of innovation with technology, with artificial intelligence, with various parties being connected onto one call where patient can be monitored remotely is managed. Well, behind me is one of the contactless clinics here at NSCI Dome. This is one of the innovation at this jumbo facility to keep the clinic in a manner where the doctors don't come in direct contact with the patient, so they consult through this glass window. Even the sample collections, the swabs are collected in a contactless manner, and all the administrative work of discharge, paperwork, etc. is also done through this. This reduces the exposure of the doctor and the healthcare workers with the COVID positive patients. Now, this is one of the innovations at the jumbo facility, and this, along with the ICU facilities, would now be given to a private company for management. As you know, BMC has privatized the management of ICUs across 5 large jumbo facilities, and they are also looking at privatizing and outsourcing the manpower resource management at the jumbo facilities, even for isolation beds and beds that are managed on oxygen. 5 large jumbo facilities would see private companies come in with their manpower to take care of the patients with the infrastructure that is being provided by BMC.
Plus patients here in the isolation ward at present. Most of them are mildly symptomatic.
They're mildly symptomatic.
Yeah.
This is not where they require oxygen.
No, this is not where they require oxygen. They are all stable patients here. We have a separate zone or a section demarcated for the patients who require oxygen on a regular basis. Dome, which has hosted so many concerts, so many programs, sports tournament, is now housing the corona COVID positive patients.
Right. Well, this is the portable ICU area which has been created here in NSCI. The ones that you see around me and the one behind me, these are shipping containers that have been converted into a full-fledged ICU with everything that is required to take care of the patient inside. There are 10 such operational ICUs being set up here in NSCI, and right now 9 patients are occupying these ICUs. And look at this area. This will mimic any normal nursing station of an ICU in any big private hospital or any big hospital. This is from where the nurses manage and monitor the patients, maintain all the records, and for any patient that requires any assistance, they will immediately rush into the ICU. Inside one of the ICU units to see what all facilities and equipment have been kept there, and also to first-hand experience how they are remotely monitoring the patients from these shipping container ICUs.
Here is patient number 3. This is J. Okay. This is J. The ventilator for 3 days. And now our state of patient is 0.90. And now we take a probe.
With me is staff nurse Mridula. She has been working here in this ICU for the last 15 days since this ICU actually got operationalized. Mridula, how many patients have you treated here in the last 15 days in this ICU facility?
We have a number of 15 patients being treated here since day 1. At current we have active 10 patients on each bed, and we are caring for them.
Okay. tell me something, you know, y'all are, what, 8 of y'all in one shift,
Yeah.
8 nurses.
Yeah.
How difficult it is to work, you know, in a condition like this with all your PPE suit and everything?
Difficult as in what this profession, we are working in this profession since the start from where we chose it. But in COVID, what the thing is, we have to take the challenge is second time harder. That is, with this kit, the shield, the gloves, our work, our interventions need to be more focused. Like for simple IV cannulation, the proper vision, proper grip we have to get. That is quite difficult with these gloves and shields. So the effort becomes twice up.
So the same thing, the effort that you put for one thing, you have to put double the effort to do
Yes.
that same procedure
Yes, yes.
on the patient.
Yes.
You were telling me 3 patients have succumbed to
Yes.
COVID-19 here in this ICU. You know, you've been seeing this work and your shifts are also like long. How are you keeping yourself mentally at peace, and you know, how are you dealing with the stress that comes with this sort of work?
For us, many of us are from ICU background. They have worked in specialized cardiac care ICU.
Oh.
And so that's what we play in. There some other senior members, we play it as a team role. Like each one has a patient and we have a team leader to guide us. So in case of that emergency or critical situations, yes, we have to deal it both mentally and physically too.
Oh.
But leaving apart, just when we have the mind, when we get a mindset that no, we have to accept it. First is acceptance. That is the first rule we do it. When we come on duty, accept it, or whatever it is, whatever difficulty you get, whatever itching you get by this mask, strips, or by this kit, whatever things are get, just neglect it, just ignore it, and then we get focused on. And that's the only thing we are following here. Just accept it and work.